and also Los Angeles, California. A warm welcome to each and every new member on the Facebook group page, and also on Instagram, TikTok, and Facebook as well, and YouTube as well. And so we want to go ahead and welcome each and every one of you. And I just want to go ahead and emphasize the importance of discussing and understanding what is consistent with and suggestive of what is breast implant illness and how your surgeon perceives it, because that's very important. Ultimately, if you ask me, when it comes to explant surgery, that is dependent on the surgeon's technique. If you talk to 10 different plastic surgeons, without a doubt, you will see that a surgeon's mindset and number two, a skill set ultimately determine what is going to be the outcome. So if the surgeon believes that the whole capsule and implant must be removed along with all of that inflamed tissue, and number two, has the skill set and has the technical ability to doing it, will then that entire process be achieved. So there are many instances I've seen where the surgeon is not believer in breast implant illness. The surgeon is still augmenting. The surgeon does not have the consistency from one case to the next. And the surgeon is not able to show the high definition pictures and videos of the chest wall showing complete removal of the capsule. Then there's always this question mark if the surgery was done in the manner as described, because remember, this surgery is relatively very invasive, involved, long, and tedious. And so the surgeon has to be able to discuss and also show that this is done in the manner that it was done. Now, what I'm going to do is we have a set of questions that some group asked, and I thought these were very nice and descriptive, and I'm going to go ahead and answer each one of them as to the best of my ability.
Okay, question number one. Do you have statistics on what % of women have BII among all breast reconstruction with implants?
So what % of the patients get BII? And certainly this is not everyone. We know that this is a subset of patients who have complaints, concerns of what is breast implant illness. This is where a young patient or old who will present in with symptoms of fatigue, brain fog, muscle aches, pain, weakness, joint pain, soreness, the fibromyalgia type issues, chronic inflammation, acute and chronic pain, capsular contracture, chest pain from the capsular contracture, ringing in the ears. This is those symptoms that basically highlight almost every single organ system of the body. Now that the patients have gone to their doctors and they have gotten their entire workup and everything has yielded nothing, now you have more and more fingers pointing towards what is breast implant illness. So this is where it's a diagnosis of exclusion. There is no lab test, no imaging test, and this is where when patients get their surgery and post-op they improve, then you can basically say it was indeed the implants, and that is the ultimate and the only way. So just within the last week, I have had patients from last Friday. I saw a patient from California. I saw a patient from Oklahoma City. I saw a patient, my post-op patients that came to me last week from California, from Oklahoma City, from Florida, from New Jersey, from a couple hours away, and patients from Canada. Now, these are patients, if you look at their complaints, you will see that they have the signs, symptoms suggestive of what is breast implant illness. One patient had imaging that showed that there was intra and extra capsular rupture of implants, and that was her indication, even though overall in general, given the pain that she had, plus the complaints and concerns, one might attest to the fact, well, she's forgetful at her age of 83. But the bottom line here is she was having some stiffness in her hands too. This is the rheumatological joint problems that are very common and evident with breast implant illness. Now, this is where we won't know going into the case if this is the underlying culprit or not. Now, the bottom line here is once the surgery is done correctly, we then talk to the patients afterwards, and they themselves, as you will see on Facebook, mention the relief that they have. Now, there are patients that have come to me that said they don't have any symptom with breast implant illness, and they wanted to get them removed because they wanted to get pregnant. And this is a very valid request that the patient had, and her 10-year mark was up. So this is one patient that her subjectively wanting to remove the implants. She was a nurse. She worked in the ICU at the University of Michigan healthcare system, and she said that I've heard a lot of bad things. And if you look at the FDA and the manufacturer warning, it says breast implants should not be put in people who are actively nursing or who are pregnant, for example. And this is her opting to basically wanting to remove her implants. There was another patient that came to me and said, I am at the 10-year mark and I've heard that they're not lifetime devices. Relatively very rare to hear from a patient. And lo and behold, I removed her implant only to find out that her right breast implant was indeed very much ruptured. And she did not know that she was going to get a explant for that reason alone. So there are patients that have come to me that had textured implants and they felt uncomfortable having a set of implants that were notoriously associated with BIA, LCL, the breast implant associated anaplastic large cell lymphoma. Now, I will say this to you, well over 90% of my patients, I will say, symptomatically improve from what are suggestions and symptoms of what is breast implant, unless be it breathing better, be it the symptoms of neck, back pain, fibromyalgia issues. Many patients that I've managed, they did not even realize that other symptoms that they had attributed to perimenopause or postmenopause were attributable to the breast implant illness. And so this is where you do not know that if it's the underlying stresses that the patient may have that may be accounting to the patient's problems. Another patient, for example, she had symptoms of very bad psoriasis. And she said that once the implants were removed, her psoriasis improved. And these are patients, if you go on my Facebook page, you will hear them directly talk about it. And this is ultimately, if you summarize it, this is exactly why I don't put in implants, or I have not put in implants in its entirety in my career, except for one set in order to get board certified. I chose not to do a surgery where patients have almost always said two things, if not 100% of the time. They wish they had never gotten implants and they wish they had removed them sooner. And well over 90% of my patients improve, just their posture improves, and you will see there is a systematic, very defined improvement that they have had because these are the concerns. Now, eventually, remember the first thing that you will see, the breast implants, they basically write down, this is the black box warning. It says, warning, breast implants are not considered lifetime devices. So remember, if 100% of the patients get implants, they will come in their lifetime that they will need to get them removed, replaced. They are not lifetime devices. If someone gets a hip replaced, that will be a lifetime device. If someone gets implants, they are not lifetime devices, as they clearly are mentioning. Majority of the patients in my career that I have talked to, they state that this was news to them when I read out the black box warning, where they were told that the breast implants are not lifetime devices. And again, this goes to showing you that this is not part of the informed consent. Many patients who get implants truly deep down within do not know what they're signing up for.
Next question, how often are surgeries to remove breast implants due to symptoms or illness being done?
So this is kind of tied up to the first question. Patients have a complaint and concern. Now remember, there are millions of patients out there who are very happy. They say this was the best thing that ever happened to them, that they got implants. Now remember, this is what happens inevitably. Patient finds out, like the patient today that I saw in clinic, she has a mom who has breast cancer and a sister who has breast cancer. So every year she gets an MRI to screen for breast cancer per her primary care doctor. And lo and behold, she gets an MRI and it shows that there's a potential rupture. And then she gets a dedicated breast MRI without contrast, which is the study of choice. And it shows that there is not only an intracapsular, but an extracapsular rupture from comparison to the last year's MRI that she had. And now she wants explant. So there are patients who find out that they have a rupture, they have capsular contracture. Out of the blue, everything goes well, 12 years. And now the 13th year, all of a sudden, the patient gets a capsular contracture. Some patients have severe inflammation, some pain. Some patients have malpositioning. Some patients have, believe it or not, out of the blue, they get an infection. This happened to my patient almost 4 months ago. She was doing great and she thought that this was the best thing that ever happened to her. Another patient, for example, ended up getting pain, and the next thing you know, she got imaging and it shows what is a rupture. And the point here is that they're not lifetime devices. If you run into problems, you need to go ahead and seek a board certified plastic surgeon who will address it definitively so that you get the care and attention. If you get capsular contracture, it is very high chance that you're going to get capsular contracture again. So you want to be very careful that you're well read on what is breast implant illness, what it means to have breast implants, and what are the implications, long-term effects. So many patients do not even know that you need, if you have silicone breast implants, that you need to get surveillance. So if you look at the Mentor advertisement, for example, not my words, Mentor advertisement, it says MRI screenings are recommended 3 years after initial implant surgery and then every 2 years after to detect silent rupture. Silent rupture basically means that the patient has a rupture, exam is unremarkable and a normal, good, healthy exam, and the next thing you know, she is sitting on what is a ruptured implant. So the bottom line here is, if you have any change in the exam, pain, complaints, concerns, questions, you need to go ahead and get the attention that you absolutely need so that you can get this addressed. It is not a matter of if, it is a matter of when the problem will arise.
Next question, are there less risks / long-term effects of saline implants versus silicone?
So saline implants cause the same hurt as silicone implants. We have read of many case reports, complaints, concerns. In my own practice, many patients that have come to me with saline implants. So this very last patient that came to me from Washington State, she has the same complaints as a patient with silicone implants, and you can interchange these patients with complaints. And she has had the implants that are certainly hurting her and causing her the many symptoms of what is suggestive of what is breast implant illness. Sometimes the confidence is so strong. Yesterday I talked to a patient and I asked her, what % chance do you think that she has breast implant illness? And from her symptoms, she said 110% I have breast implant illness. This is how confident some patients are. My patient from India, for example, she's sitting on the other part of the world. She does her homework, she does her networking, she listens to the patients, and she says, this is verbatim, copy paste the same set of problems. Same set of problems as saline implants as silicone, because remember, the shell of that saline implant is made up of the silicone, and it is leaching these small particles of silicone. There is silicone toxicity and reactivity, and now the patient's complaints are consistent with what is that the many symptoms of what is, the dermatological skin rash issues, chest pain, capsular contracture, arrhythmias, amongst the many other problems, including dryness of the eyes, rheumatological joint problems. And what is very interesting is this is a very defined entity. Many surgeons have said, unfortunately, that breast implant illness does not exist. So if you go back to the black box warning, you will see it says, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Right off the bat, I'm going to stop here and says they're telling you this is a breast implant illness that exists. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms. Complete resolution means cure of symptoms when the implants are removed without replacement. And this is telling you that the implants are not safe. When they banned silicone implants from 1992 to 2007, they should have banned saline implants because they cause equal hurt and harm as silicone implants. They do rupture, as do the silicone implants. They have their own set of problems, similar problems. They are also implicated in that rare BILCL, but to a lesser extent, especially if they're textured, higher chance. But even the smooth saline implants are implicated behind what are the illnesses that we hear of from the many patients that have the hurt and harm from the breast implants. So saline implants, silicone implants, interchangeable, similar set of problems. This is just like saying cigarettes and cigars, they both have nicotine, they both cause harm. Yes, you may have a filter on a cigarette. That doesn't mean that you're immune or basically not likely to get problems such as cancer, among others. No, you bet you can, and patients do. And so even though there's a filter, so it is very analogous to that. There is absolute harm and hurt, and the same, for example, psychological problems that these implants cause. in saline patients equivalent to the silicone implants. And it is a misinformation that is shared that saline implants are safe, which is absolutely incorrect. And one more question, please.
Okay. Should someone who experiences capsular contracture request explant?
This is a very good question. Capsular contracture is basically a very known, defined problem complication of what is a hardening of that capsule around the implant. So you have 4 grades of capsular contracture. Grade 1, where the breast is soft, implant is non-palpable or visible. Grade 2, breast is solid, implant is palpable but not visible. Grade 3 is breast is hardened, implant is palpable and visible, so you can see that black rim of the capsule around. And number 4, the breast is deformed and painful, implant is palpable and visible, which is the highest of the grade 4 capsular contracture. It is abnormal to have capsular contracture and to be living with it. No one should have to live with a hardened capsule on their chest where they're not able to give hugs or be able to, as a result of the contraction, move their arm freely. It does limit movement depending on some patients and restrict shoulder, neck, back problems that occur. Even turning the head right and left will be affected depending on the nature of the capsular contracture. It is abnormal to be living in pain, and you should seek a surgeon who is not going to do a capsulotomy but remove the capsule in its entirety. And it is not healthy, again, to be living with capsular contracture. The entire capsular tissue needs to be removed. And remember what I said earlier, if someone gets capsular contracture once, chances are relatively very high that they're going to get the capsular contracture again. We do not know why it occurs, but certainly patients who have implants that are bigger, larger, higher chance. Implants that are placed above the muscle, higher chance. Sometimes a biofilm can form that can lead to what is capsular contracture because of the way the implant was placed. And again, the bottom line here is mass majority of the cases, we do not know why it occurs. So.
Would you like to answer another question, Dr. Khan?
Sure, one more question.
Okay. Do you see more breast implant illness with implants under or above the muscle?
So above the muscle is where more problems are. Now remember, I'm going to make a few valid statements that are defined and they're not to be contested, if you will, if you look at the medical and scientific and plastic surgery literature. Any good, reputable, board-certified plastic surgeon should not be augmenting. Any good, reputable plastic surgeon who was augmenting will place the implants below the muscle. Less chance for contracture, infection, problems. It is more secure. The muscle works as an internal bra and certainly has overall a better, longer lasting results. The implants, when placed above, lead to more problems, complications like capsular contracture, infection, malpositioning, and asymmetry, among others. And this is where placement of the implants above is not recommended at all. If I see 1,000 patients that have come my way, 900 to 950 of them will be below the muscle because that's where any good, reputable, board-certified plastic surgeon would have put them. And again, in today's world and age, knowing what we know now, given the many uncertainties, implants are not worth it. Safe devices do no harm. Do not touch, especially in the young patients who are getting the ballerina micro-textured Motiva implant. Remember, implants are implants no matter what. There will come a time long-term that they will only be proven to be not safe, and you will see the same hurt and cry that we see from the many patients who got implants and who are certainly hurting, and you will see that they are not safe devices. No one walks into my clinic and says that the implants are making them better, think sharper, they can jump higher, or they have more energy, or they have the skill set has improved. If anything, implants only hurt the body. Patients have only complaints, one hurt after another. Some patients have fluid around, some patients have a rupture, a capsular contracture. There's never a good result, if you ask me. It is transient and temporary. So if you look at page 11, risks of breast implant surgery. I understand the risks of undergoing breast implant surgery include breast pain, skin or nipple areola sensitivity changes, asymmetry, impact of aging, weight change, infection, swelling, scarring, fluid collections, hematoma, tissue death, inability to breastfeed, complications of anesthesia, bleeding, chronic pain, damage to surrounding tissue such as muscles, nerves, blood vessels. And remember, they also mentioned over here that I understand the long-term risk of breast implants may include painful tightening of the scar tissue, rupture or leaking of the implant, wrinkling of the implant, visibility of the implant, shifting of the implant, need for reoperation. And remember, the other thing it says over here on page 14, I understand that silicone can migrate from my implant into nearby tissues, chest wall, lymph nodes, under the arm, and organs, liver, lungs, where it may not be possible to remove. I understand that breast implants can interfere with mammography and breast exams, which could delay the diagnosis of breast cancer. Then in itself would be a reason to not get implants, minus all the other reasons that I read. Mammography can also cause the breast implant to rupture or leak. I understand that all breast implants contain chemicals and heavy metals. I understand that most of these chemicals stay inside the shell of the implant, but small quantities have been found to diffuse gel bleed through the implant shell of the silicone gel fill implants, even if the implant is intact and not ruptured or leaking. And so the bottom line here is we need to take this into consideration. And for those who are interested, this is breast implant certain labeling recommendations to improve patient communication. Use U.S. Food and Drug Administration issued September 29, 2020. These are all facts, not my assessment. This is well published, and you should do your homework so that you can learn more about, if you have implants, what you need to know about them. If you're considering implants, you need to know what you're signing up for. This is part of informed consent, so that you are a well-informed patient. Till next time, we'll meet again. This is Dr. Khan. Please ask questions. I hope to do one again tomorrow so I can answer any specific questions one may have.